Have you heard about Spravato, a novel treatment approved by FDA for treatment-resistant depression in adults? This is actually approved for people who are still suffering with depression but who have not responded to either 2 or more antidepressants. If you have not heard about it, let me take you through and show you what makes it different and how it's actually used. Spravato is a nasal spray form of esketamine. This actually works on a different brain pathway compared to regular antidepressants. It works on NMDA receptors and triggers the release of glutamate, which helps the clients to feel the difference within the first few days to few weeks. However, the treatment response might vary from a person to person depending upon other factors. So we monitor the progress closely and manage the treatment plan accordingly. So how is it actually used? We first thoroughly evaluate for the client each client's indications, contraindications, risks and benefits. And once the client is cleared for the treatment, we proceed with the session. We make sure the vitals are stable before the session, like temperature, oxygen saturation, blood pressure, heart rate. So that's why it is only administered in healthcare settings, which meets the criteria of REMS, that is Risk Evaluation Mitigation Strategy, to ensure the client's safety. This is administered by the client themselves. We make the patient sit on a relaxedly in a chair in a calm environment. We give them the device, ask them to hold it upright, ask them to gently blow the nose and put it in one nostril and slightly tilt the head backwards so that the medicine is absorbed nicely, and then press the plunger to spray. It's repeated in the other nostril, and we actually in the initial sessions we go up to 56 mg, 2 boxes. After 5 minutes the second box is repeated, and based upon the progress of the client we go up to 84 mg. Usually in the first 4 weeks, which is called induction phase, it's given twice weekly, and moving forward in maintenance phase, it's given once weekly from 5 to 8 weeks, and from 9th week, we usually try to see, as per the tailored needs of the clients, we go 2 weekly ones or 3 to 4 weekly ones, and we slowly taper the medications. Some of the common side effects reported by the clients are mild dissociation, nausea, increased blood pressure, and mild dizziness. However, they pass very quickly, and we monitor them for the first 2 hours, at least 2 hours, and once the vitals are stable, we advise them to go back home. So finally, what I would like to convey to you all is treatment resistance doesn't mean untreatable at all. There are so many advanced treatment options like Spravato, RTMS, which is transcranial magnetic stimulation of the brain. So there are all new paths which helps us to move forward. So there is always a hope for healing. Kindly do not lose that hope. Thank you.